Okay, good morning, everyone. We're back for our third live Q&A session for day 3 of the Dog Anxiety Summit. I've got my trusty old offsider here, lovely old Pearl. And day 3 is all about dog training, socialization, behavior modification, and particularly focusing on positive reinforcement training as part of one of the very important 4 facets that we need to address when we're treating anxiety in dogs. So we have environmental modification, where we're looking at the triggers and the stimulus that cause the anxiety, minimizing exposure to that stimulus that causes the anxiety response. The second pillar is the behavior modification and positive reinforcement, socialization, desensitization are a sort of one way that you can help modify the behavior, change how the animal feels about stimuluses by desensitization, change how the animal feels by building positive associations with things that they used to find fearful rather than not. And of course, the other way that we can very powerfully change behavior by behavior modification is with therapeutic touch. And you'll be learning about that from me in a talk tomorrow. But our speakers today have been Dr. Ian Dunbar, talking about fear periods in puppies and developmental stages. And if you've listened to that, you'll know that what he's really talking about is how he believes that fear periods simply don't exist in puppies that have been properly socialized. Teody Anderson spoke about why aversives make anxiety worse. Using aversives in training is anything that causes fear or pain. And if you're looking at the worst end of the spectrum, you'd be talking about shock collars and prong collars and stuff like that. So there's very good reasons why you should absolutely avoid aversives like the plague in anxious dogs. Never, ever use them in anxious dogs. We dig into that with Teody. Kamal is speaking about positive reinforcement and behavior modification. So using that R+ training to help shift anxious dogs out of anxiety and into comfort and ease. And then we had Ness Jones was our last speaker for day 3, talking about decoding separation anxiety, which is also a very important thing to do. We got Christina. Dr. Christina's offsiding there with me in the chat. Thank you very much, Dr. Christina. Lovely to see you there, and lovely to see you reinforcing and reviewing a little bit of Dr. Dunbar. Yes, need to have 100 different people interact with your puppy in the first 8 weeks. All kinds of different people wearing all kinds of different things. Okay, so then we got some questions, hopefully we've got lots of you here live on the show this morning, but please start typing, get your fingers dancing on the keyboard. Let me know what the questions are, because I'm very excited to be able to be here and to answer your questions this morning. So our first question comes from Ruby. Hi, just wondering if I can give my golden retriever rescue remedy if he's already on CBD. Do they interact? So rescue remedy is a flower essence. It's a fantastic flower essence, one that I highly recommend that you have available to support your anxious dogs all the time. It's totally safe, totally non-toxic, and there are no interactions with flower essences with any other kind of medications. Perhaps with homeopathics, you might want to not be giving them at exactly the same time, because they're both energy medicines, and you can get some interference between the 2 types of energy medicine. Not that could ever cause your animals any harm. It just might stop the homeopathics or the flower essences working as effectively as they should. But when it comes to herbal medicines like CBD, prescription medicines of any kind, you can absolutely use them. And Dr. Christine is saying, nope, it's fine to use flower essence with homeopathy, no interference there either. So thank you for correcting me on that one. Okay, we need some more questions. I know that we've got more than 50 of you here on the this live Q&A session. The summit's been going really well. We've been getting a lot of positive feedback from people saying how much they're learning and how much they're enjoying the presentations. And Robin says, happy Monday. Thank you so much for getting up early to do this. It is a little bit early here. It is just after 5:30 in the morning, Australian time. And it's a little bit chilly, as you can see. I'm rugged up and I'm cuddling my lovely old dog here to keep me warm. Awesome. We've got another question from Myrna. How do I deter self-harm? I have an English Bull Terrier Staffy mix who is a rescue, about 4 years old. He scratches himself when meeting new people that come into the house, and his dog relative, I think you mean reactive. With these animals, that it's kind of rare to get this expression of anxiety, but some of these animals, when they flip into the red zone, one of their behaviors is to start attacking themselves, scratching themselves. It's not a very common thing, but it can happen. So what's happening is that if you get any animal that comes to the point of doing any behavior that causes themselves harm when they have an anxiety response, then I would really think that that animal has gone up into the high orange zone or crossed into the red zone, so that their arousal levels are getting to a point where their front brain, their forebrain has turned off, and they're in total fight, flight, survival mode. And the behavior, if they're causing harm, that's what's happening. So what can you do? Well, you need to reset the whole nervous system and that dog's experience of how they relate to people coming to visit. Now, the first thing I would do would be to put that dog on lead. Whenever I have anyone come in who has an animal who goes ballistic, gets out of control, gets overexcited, goes into that fidget, crazy, hyperactive, anxious response when people come to visit, my first recommendation is that you have the dog on the lead before anyone gets there, and maybe be doing a little bit of yielding to pressure and random lead walking before the people get there to get that that dog connected with you and focused on you and a little calmer. Now, what you can do then when the people arrive is, if the dog starts scratching, you can start moving them around on the lead, get the people to sit. So just sit down on the chair, please. I just need to work with my dog a little bit, because they freak out when people come to visit. So that's one thing that you can do, is to then you might be walking around. You might even take the dog outside for a few minutes and walk them around the backyard to settle them down. Then therapeutic touch, all of the other holistic, alternative, complementary treatments that we've talked about, flower essences, rescue remedies sometimes can help these dogs. Talk to a homeopath. Try the different herbal medicines, CBD being probably the strongest of the complementary and holistic herbal medicines for anxiety. And you'll also want to be working with a trainer, working with a good positive reinforcement trainer. And of course, if all these things aren't working and you're still getting this self-harm behavior when people come to visit, then you might need some pharmaceutical medication as a bridge, just to bring that animal down to a point where all the other training and touch and holistic treatments can work more effectively. Monica has got a question. Can you talk a bit more about using touch with touch-sensitive dogs, please? Okay, so I work with a number of dogs that when I first go to touch them, they're like, whoa, what are you doing? What are you doing? And Pearl loves all kinds of touch. She loves being cuddled. So I will start off working with these dogs on lead, or so that they can't run away. Okay, so what I talk to about people about with touch sensitive dogs is that you almost need to think of the touch as a medicine that tastes a bit bad, but it's actually really, really good for the animal. So start off slowly, start off gently. If the dog will tolerate touch anywhere on their body, then you start touching them where they'll tolerate it. And you might put a timer on for 10 or 15 minutes so that you've got a structured time, right? It's touch medicine time. Your dog may get a little frustrated. Your dog may be going, oh, I don't want my touch medicine. But if you're learning the therapeutic touch, it really is like a medicine. It's a therapeutic intervention that causes a change in the physiology of your animal. It causes an upregulation of the parasympathetic nervous system, which causes a relaxation response, a body relaxation response. And often with these animals, when I first work with an animal, therapeutic touch, relaxing touch, we'll see that the animals have this body level relaxation. And then their mind goes, oh my God, I'm relaxed. Why am I relaxed? There's a tiger in the room. It's going to eat me. I can't be relaxed. And then you keep on with the touch and they'll go back into relaxation and go back into arousal. But what will happen over time is that they'll go into deeper and longer periods of relaxation. Another thing that I'll use with animals that are not used to touch, that haven't been touched much, is that I'll use a wand. I'll use something that's not my hand. If it's I've used a wooden spoon for one little white fluffy dog that was very bitey and fearful. So I could hold the lead and direct the head a little bit away from me so I wouldn't get bitten. And that dog could tolerate me touching gently and stroking gently with a wooden spoon. And then I could transition to my hand. I've done that with a number of dogs. It can be a very, very helpful way to do it. We're up to 63 people here live with us today, which is totally awesome. Welcome to everyone who's joined us in the last little minute or two. And please, in the chat, let us know what's the best thing that you've learned at the summit and what you've enjoyed most. Who's the best speaker that you've enjoyed in the summit? Please let us know in the chat. Give us some feedback about how you're enjoying the summit and how you feel like it's going to help your animals. So we've got Claff. Our 1-year-old dog is anxious at sounds in the garden and from outside the house when she's in. On walks, she's very cautious about other dogs. What's the best approach to help her? Okay, so she's a relatively young dog. So it should be a little bit easier to help her reset her sound sensitivities and her potential reactivity. If you've got a dog that's cautious about other dogs on the walk, that's a little bit standoffish and worried about them, that can escalate to more overt reactivity if you're not careful. So it's good that you're here and taking action. The best approach, number one, is to really, and I'm going to echo what Dr. Christine is saying in the chat there. Your emotions can make a big difference to your dog. So I think I might want to emphasize that a little bit today, that the more that you can get yourself into a really calm, settled, grounded, coherent state in your emotions, in your physiology, and in your energetics, then the more your animals, because your dogs watch you and they are cued by you and they empathically feel your inner state very strongly as well. So the more that you can be calm and grounded, and if there's a noise and your dog reacts, you can say, okay, thanks for letting me know. Come on, come over here, come and sit with me. Sit down. And what I'll often do then is I'll put them on a lead. If they're not going to be responsive to me, ask them to come and do something. I'll say, on your bed, stay on your bed. And I might have a little timer where I'll ask them to stay on the bed for a few minutes, so that is a way to help that dog. I'm on my bed, I'm comfortable. Another thing that you can do is that you can have some little Kongs in the fridge or in the freezer, so that you can have some high value food in that Kong. And if there's going to be a day with a lot of noise, you can then give the dog a Kong, something to distract the dog from the noise that they find to be a fearful stimulus. Those are things you can do. And of course, at the same time, the relaxing touch. As I said, any of your normal patting, but really slowly, like Pearl likes her ear stroked. And my normal sort of ear stroking speed is about this speed, I would think. So if I slow that down to really, really slow and get really present and connected, so that I'm totally present with my dog, no picking up the phone to look at Facebook, anything like that, giving my whole attention to the dog, then you will start to, that is just a little tiny beginning of relaxing touch. And of course, all the supplements, perhaps the Thunder Shirt can help some of these dogs really well. Pressure on the body. There's a whole lot of different things that you can do that you're learning in this summit. Now, of course, you're learning about 5 million things that you can do in this summit. So the other thing that's important to do is to pick out, have your short list of anything from maybe 3 to 5 interventions or treatments that you want to try. And it's probably a good idea to only bring in one at a time, even if you're bringing in one at a time 1 week and then you bring in another the next week, so that you've got a little bit of clear air and you can get a sense of how your animal's responding. And you want to go on with that. You want to get some really good, professionals helping you, trainers, holistic veterinarians, holistic practitioners, all that sort of thing. But you've got every chance of really being able to help your dog if you do all these things. Over. From Tara, any tips to make my 3-year-old rescue more comfortable with the daily thunderstorms we're having? He's not generally anxious, but very loud noise make him shake. Currently giving him 2 Herb Smith products. Definitely try a Thunder Shirt or the T-Touch wraps. You can find online places to, get different pressure wraps. So deep pressure on the body can help. Weighted blankets can be another way to do this instead of a wrap. Now, with weighted blankets, again, you might need to sit with your dog and gently insist that they stay under the weighted blanket. Often one of the responses of anxiety is that they get they want to move around. They want to pace. They don't want to settle and be still. So weighted blankets can be a helpful way to do that. I've used weighted blankets with some success, but again, most times when we put them on the animal, they're like, oh, what's this weird heavy thing? Get it off me. I'm out of here. So you have to, sit with your animal. You're comforting your animal as the Thunder's there, spending time with them, holding them, touch, rescue remedy, all of those kinds of things. And yes, someone in there is saying if your dog is anxious, you can act the opposite. Deep breathing, lay down, curl in a loose ball, along with the other suggestions, which are very good suggestions, by the way. And I've spoken about that already a little bit today, but your inner state, the more you can relax and be calm and not get caught up in your dog's state of being, the more they will follow you. And I've found that the therapeutic touch, relaxing touch, is very, very helpful for thunderstorms. CBD can help as well. Have them on CBD during storm season, rescue remedy and all of that. Okay. If we've got someone asking how can they get access to the past talks, you can absolutely purchase lifetime access. Now, I'm not sure if Jindy can give us a link that you can use to get into to purchase lifetime access right now, but when you log into the summit, there will definitely be a spot there where you can invest in the upgrade. I think that's the link, Jindy, that you put up for the post-summit anxiety masterclass intensive course, which is a different thing again. But regardless of when you just log in to the anxiety summit, there will be a spot there where you can have the VIP upgrade to get lifetime access. Let's talk a little bit about the course, because Jindy's put that link up there, and I'll just ask Jindy to pop that link in the comments stream as well, so that anyone can see it in the stream and click on it. So I'm going to be leading a 4-week deep dive into creating and implementing a holistic anxiety treatment plan for your dogs after the summit. And that's the masterclass. So maybe Jindy did have the right link up. If you could just pop those 2 links in the comments stream with a little description of each, just letting people know which is which as well, Jindy, that'd be great. And now we'll do another question. And particularly there's a question from Jessica there down at the bottom, Jindy, which I'd like to answer next, because I'm very keen to do that. Okay, my 5-year-old English Bulldog is very reactive to the door and me leaving the house. I'm working with a trainer, but they're talking about using a TENS collar. Is this a shock collar? I'm just going to do a little bit of research on Google here. You know what? That is a renaming of an electric shock collar to make it seem like it's not an electric shock collar and it's something that is benign and okay to use on your dog. So, you might see these electric shock collars renamed as correction collars, as TENS collars, as anything but an electric shock device, which is what the damn things are. And please don't ever use them on your anxious reactive dogs. I have seen a number of animals that have been made a lot worse because of these shock collars being used on the animals. So absolutely, if you get any trainer that wants to put a collar on your dog that has the 2 little shiny metal electrodes that press into the skin and then zap your dog with an electric current that is uncomfortable, painful, and makes things worse, you might seem to get results in terms of suppression of the anxious behavior, but you're going to cause mental, emotional trauma and harm to your animal using these collars. Please do not use them. I have not come across them being called a TENS collar before. Now, the TENS device is a device that's used for humans for pain relief, which is an electric stimulation, but there's a very different thing that you can talk to the human. You can say, okay, we'll turn it up. Is that okay? Is that level good? And the person can say, oh, that's too much. Stop. Your dog can't. And honestly, they're just dreadful things, shock collars. Please don't use them. Now, at the bottom of the comment stream, you're going to see a link there, petsummits.com/anxiety/order. If you want to get hold of the lifetime access ticket, just click on that link in the comments. It'll take you through and do that. Okay, what's the next question? Michelle says, my sweet senior boy recently became deaf. Are there ways to help him adjust and not make him anxious with this new change in his sensory? Look, that's a difficult one. When older animals lose their senses, when their vision starts to dim because of cataracts, and when their hearing starts to dim and they become deaf, it's a difficult one. So touch. Give your dog lots of touch. Let your dog be able to see where you are. And, this old one here, I've noticed that Pearl's thunderphobia has actually improved recently. Now, I think the only reason that could be happening is that her hearing is starting to drop off, and a lot of her anxiety, her separation anxiety, has got worse as well as she's getting older. So comforting them, CBD can really help be a good calmative. You can add in the other herbal medicines like ashwagandha, which you're going to hear about tomorrow with Dr. Matthew Muir on day 4, when we dig into veterinary treatment of all of this. And basically trying to help your dog. Another thing that you can do, particularly if they're going blind, is make sure you don't move things around in your house. Try and keep things the same in terms of where your furniture are and your routines. That can really help these older dogs as they're losing their senses, is to have this nice, solid routine so they know what's happening and when it's going to happen. Okay, what suggestions, this is from Robin, do you have for a dog who only wants to look for the local feral cats when taken out for walks? She is totally focused only on finding them, to the point of crawling under cars. Okay, that's not exactly anxiety, but I suppose it's kind of over hyper focus and over arousal, which does fit into the same sort of category as anxiety for our dogs. That's a tough one. So I would do a lot of yielding to pressure work and random lead walking at home in the backyard. I'd also see if I can find the highest value treats that this particular dog loves more than anything else. Work with a positive reinforcement trainer to get the dog to connect with you and look at you. That could be a very helpful thing to do with this kind of behavior. If your dog is really strong on the lead, then using a head collar like a gentle leader, which I've found is, Holty was the original brand, but I found that the gentle leader, when properly fitted, is the most effective of those kinds of things. But it can be hard because this is a natural prey drive. Your dog's got a very strong prey drive, and this is a natural behavior. This is a normal dog behavior in the wild. So, but you do want to get your dog to refocus, and you also want to get your dog's arousal levels down, because what's going on here is when they're thinking about the cat, they go into very high levels of arousal, and that's just, then their behavior becomes dictated by that very strong focus with the animals, trying to get the cat, trying to eat the cat, which is not absolutely helpful. And Jindy has just put in the premium pass link again in the chat for you to order that pass if you do want to get lifetime access to all the videos. Okay, what's our next question? We're getting lots of really good questions here. From Bookie, Dr. Ed, do you know anything about the use of medical marijuana in dogs for anxiety? Yes, I use CBD often as a natural herbal supplement and medicine, powerful medicine for anxiety in dogs. It's not, doesn't have a strong effect as some of the prescription drugs, but it's certainly one of my first go-tos with anxious dogs, that we see how they respond to it. And not only is it good for helping reduce anxiety, it's also good pain relief. It's a fantastic anti-inflammatory. It's fantastic for gut health, for the health of the nervous system, for health of the immune system. So it's a very good medicine. And I'll answer one more question, then I'm going to talk a little bit about, so I'll answer the question if you leave that one up, Jindy, please, that'd be great. But I'll come back after the question. Next question. Just waiting for the next question. So from Regan, for a rescue dog with many traumas and fears and so many ways to treat anxiety, how do you decide what to try first? How long to try something before adding an additional treatment or deciding it isn't working? That is a fantastic question. Now, that is a question that we are going to be helping you answer and implement in the masterclass, the 4-week masterclass that we're doing after the summit finishes, starting on the 17th of September, which will have a session each week where I go through a whole lot of information that's going to help you formulate and implement a holistic dog anxiety treatment plan. And a second session each week is going to be a Q&A session like this, but a deeper dive. Very small class size for this masterclass, only 20 people, so that we can make sure that everyone gets all the time and attention they need to be able to really take a deep dive into creating and implementing a holistic treatment plan for your dogs. But let's give you a little taste of this now. So it's really important to keep a journal. To every day write down and record. And the first thing you want to do in your journal is write down the whole history of what's happened with the anxiety. You need to know what triggers are so that you can manage the environment, reduce the exposure to triggers as much as you can. But it depends a little bit on the intervention. But you should see at least some kind of response within a week to 2 weeks of implementing new things. Now, what you're going to try first is going to depend a little bit on where your dog is at with their anxiety. So if you've got milder anxiety, then you can try the more milder interventions, the more natural things, the rescue remedies, the more holistic alternative complementary treatments. If you've got an animal that's got really severe anxiety to the point where they're harming themselves and perhaps a danger to other dogs or other people, those dogs I tend to dive into prescription medication earlier, just because they need more help, and I particularly don't ever want to have a dog escalate to the point where they are aggressive and injure another dog or a person, because that can be a really big problem. Okay. Another question. Marley is a rescue from Egypt, extremely fearful. He backs out of his leash on a walk if he gets fearful of pretty much anything different all the time. So, these rescue dogs that have been street dogs are very different dogs than any other kind of dog, because their socialization has been, all they have experienced is that one little area on the street where they grew up. They've not had touch. Usually they've never been on a lead. And you can take a long time and a lot of patient work and interventions and training to get these dogs to be happy and comfortable. He might be better off not walking. Some of these dogs are way happier if you don't put them through the stress of taking them out of the yard where they're comfortable and happy. You play enrichment games and training games at home. One thing I would say is to get a well-fitted harness with a front clip rather than a collar that he can pull out of and back out of. You want something that he can absolutely not back out of if you're going to be taking him out into the wild, so to speak. And the Hakihana, Haqihiana, are one of the best brands and designs of harnesses once you get them well fitted. There's another question, same question with Ruby Ward. How about collars that have tone or vibrate? Those are technically aversives. And again, they're not something that I recommend. The sound, the vibration, or some of them have a spray of something that the dog doesn't like that sprays out. All of these stimuluses from the collar are designed to be uncomfortable and to make the dog change their behavior because of an uncomfortable stimulus from the device. So they're technically aversives, and I absolutely would not recommend using them ever in any kind of dog, and especially in anxious dogs. What is best during fireworks? So being proactive. Well, I know that in the US around July the 4th, you can get fireworks in a period of time right around that holiday. So you would want to start, if you've got a dog that you know has firework sound sensitivity, and this old girl is the reason that I've not gone out and had fun on New Year's for the last 10 years or so, because I have to be at home with her to hold her little paw because she hates fireworks so much. But being proactive is really important. So you want to make sure that you're getting onto treatments, especially CBD, maybe Zolkine as well, maybe L-theanine as well, a week or two before the fireworks arrive. It might be wise to go to your vet and say, hey, fireworks season's coming. Could I have some situational anxiety medication like gabapentin, clonidine, trazodone before they arrive? And if you've got a really severe firework anxiety, and the main reason that I consider prescription drugs there is to reduce the suffering of the animal, the distress and pain from the anxiety response. And you want to test them on the medication too, preferably if you've got an animal that has a really severe phobic anxiety to sounds like that. When they had the medication, you want to see that they're at least lightly sedated. They want to be a little bit sleepy to be calmer. Then when you get to the fireworks, make sure you're with your dog. Make sure you're holding your dog, you're giving them comfort, you're staying really calm and relaxed to be an anchor for your dog. The thunder shirts or wraps, the flower essences, homeopathics, all of these things can be used together. There was another question saying, I don't know if you can find it, Gingy, but someone was asking about, all these different things. Is it too much? But yeah, during the fireworks, I've talked about a little bit about being proactive before the fireworks, but during the fireworks, lots of comfort, lots of loving touch, firm pressure, holding and hugging. So can using multiple methods become too much for them? Medication, adaptil, aromatherapy, music, CBD, positive training, etc. Am I overdoing it? No, you're not overdoing it. And I find that you tend to get the best results with these anxious dogs when you find the best constellation of treatments that works for your dog, that you have a really holistic, integrated treatment with a lot of different interventions that all work together, because you get a synergistic response when you use multiple interventions. It's like the result you get is greater than the sum of all the different things. And that's where keeping your journal and, bringing a new thing in. Do I notice a difference? Does my dog better with this? If my dog does notice a difference with this, then we're going to keep going with it. And then another week or two later, we might bring in another new thing. But no, I don't believe that it can become too much. Now, as your dog's healing journey from anxiety unfolds, it might be that you'll then drop some things and add in different things, or you might not have the need for some of these interventions as your dog heals and becomes more resilient and healthier. And then, something might happen which is traumatic for your dog, and they might relapse somewhat, and you might have to bring those things back in. So the other thing is being really dynamic about that. How can you stop OCD behavior during an anxiety episode? She likes to chew and suck on her back paws when overstimulated. Is this okay as self-soothing? I'd probably try to redirect that behavior. I would potentially have the animal on the lead so that I could then move them around, get them engaged with connecting with me, do some training games, look at me games, all those sort of things. Loving, relaxing, therapeutic touch can be really helpful. And I might just talk a little bit about therapeutic touch right now. So coming back tomorrow to day 4 for the veterinary treatment of anxiety, and my presentation on day 4 is all about this therapeutic touch approach that I have developed. And if you could pop the link for the My Silent Pain Masterclass and up on the screen, and also pop that link in the comment stream as well, so that people watching on the comments can see it. So I started off with using therapeutic touch for neck pain and back pain, and then I realized that there's a whole lot of soft tissue pain, so I started working to help animals with soft tissue pain. And then what I worked out was that there's particular kinds of therapeutic touch that cause this really beautiful, profound body level relaxation. And I have made this a really cool part of how I help anxious animals. I teach people how to do this with their animals. For instance, I had Clyde come to me a few years ago. He was a staffy who had severe separation anxiety. He was eating the house when left alone. He was really tearing all the plasterboard off the walls, extreme distress. 2 weeks of the whole energy body balance, relaxing body work, and Clyde's destructive behavior was totally gone. And he wasn't even getting off his bed some days when his mum came home. He was so relaxed and chilled on his bed. He's like, oh, mum's home. Yeah, couldn't be bothered. And, you know, I've got dozens and dozens and dozens of stories like this of how this relaxing approach to using therapeutic touch with your animals can cause a really strong relaxation response. So what we want is the link for the silent pain one in the comment stream, please. Jindy, there it is on the screen. I don't know if it's clickable on the screen or not, but Jindy will just pop that in the comments as well. If you want to learn more about therapeutic touch and how to help your animals with therapeutic touch, relaxing therapeutic touch from the Whole Energy Body Balance method, click on the Whole Energy Body Balance /silent-pain-webinar-series-registration, which should pop up in your comment stream as well in just a second. Jindy will pop it in there for us. And in that masterclass, there's a couple of things we address. One is silent pain, and every anxious dog needs to be assessed for soft tissue pain because it's very often missed, and any amount of chronic pain is going to cause problems in that it makes the anxiety worse. Jindy, could you just pop this link that's on the screen there with me in the comments as well, please? And the Hakihana Connors, the Hakihana so Jindy, the link there that's second last in the comments is actually for the Pet Summits Anxiety Masterclass rather than the Whole Energy Body Balance one. So if you just pop that in as well in the comments, that'd be great. So Hakihana is the brand that just popped up there. It's hopped up again. Now, if you've got a dog who pulls on a harness, what you've got is a dog who doesn't understand how to yield to pressure. So you need to work with a trainer to get that dog to understand about yielding to pressure and not leaning on the lead. And if a gentle leader works better for that kind of dog that pulls, then that's great too. Okay, what's our next question? So what can I do for a dog that licks me or himself obsessively? I definitely think he does it when he's anxious, but I'm not sure about what. It usually happens when I'm sitting on the couch with him and my other 2 dogs, so maybe he's being possessive. obsessive licking, that is a bit of a difficult one again. It's a hard one to put in. So again, you need to go back to the whole thing of getting them to learn how to relax, teaching your dogs how to regulate into relaxation, doing a lot of relaxing games, using touch to help with the relaxation. And all of that. So basically, you need to get onto creating and implementing a holistic treatment plan for your licky dog. And the other thing is to say no, no, stop that. No, I don't want you to lick me. No, please don't. Now, I do that a lot of the time because I absolutely hate the sensation of being licked by a dog. It's one of those things, it's like fingernails down a chalkboard. It does my head in, and I really, really, really don't like the sensation of it at all, because I just don't like it. And some dogs just like licking. It's kind of a normal dog behavior. So it's okay to tell your dog not to do that, to set a boundary with your dog around that behavior. No, I don't like that behavior. Please don't do it. But if they're anxious, they might not be able to respond to the command. So then you need to work on getting the relaxation levels up, using therapeutic touch, using all the different holistic and alternative complementary treatments, medications, music, flower essences, homeopathics, herbal medicines like CBD, working with a trainer. All of those things can help. Maybe put something on your skin that tastes bad, says Christina. So, yeah, you can get bitters, which we use to stop dogs licking at their surgery sites and wounds. But the thing is, you've got to remember not ever to, if you're going to put it on your fingers, not ever to put your fingers near your mouth because it really tastes awful for you too. What was that question, Jindy? Ellen says, I have a foster dog that came to me at 5.5 months old and already fearful. He's now 14 months old and has a really hard time accepting strangers. He's fine with me, but no one else so far. So what you can do here is work with a really good trainer to desensitize them to strangers. If you have people come and visit, make sure you got your dog on lead. Make sure you've got a pouch full of the yummiest, most high value possible treats. I think the highest possible value treats are the roast chickens you can get at the supermarket, and you take the whole breast off and cut it up in little squares. So you can desensitize these dogs to this fear of strangers over time. You would start off with working with a really good positive reinforcement trainer to help you would be probably of great value. And lots of rewards. Dr. Ian Dunbar, in a pre-summit interview I did with him, talking to his community, was talking about how he'd taken this dog that had really severe anxiety and reactivity, a COVID puppy that he thought was almost unsavable, really. And he thought, I'm going to try something new. I'm just going to go out and I'm going to sit on a park bench with the dog with me for 4 or 5 hours. And he sat there with that dog and he kind of ignored any anxious behavior. And anytime the dog showed relaxation, he'd give him treats and positive reinforcement. And he just talked to the dog the whole time. He said, oh, look, there's a person coming along the path, and here they are. They're going to walk past us, and, wow, they look like a nice person. They're smiling, aren't they lovely? And he said that he was absolutely amazed at just how much that dog improved from that one long, gentle desensitization and positive reinforcement of the behaviors that they were looking for. So, he would reward any kind of calm behavior. And he would also reward lack of reactivity to people going past. So every time someone went past and there was no reactivity, there'd be lots of positive reinforcement. So that's another approach that you can use with these dogs is just giving them a whole lot of time. And Dr. Ian, Dr. Dunbar said, well, I know what I'm going to do now. Next time I'm going to take my computer. I'm going to take my laptop and I'll get a whole lot of work done while I'm doing this slow, long sessions of desensitization and positive reinforcement with the dog. So that might be something to try too. Jessica says, is it okay that I place my dog's food down and leave the house when he is distracted, or is this teaching him fear because then mum disappears? He's a rescue, has a lot of anxiety being left. I strongly encourage you to go back and watch Ness Jones's talk about decoding separation anxiety. What you're doing is not a good idea. What you're doing is going to then actually condition this dog to find having food, which should be a pleasurable experience, to be a fearful, anxious experience. Now, you're doing that unwittingly because you're just trying to find a way to get out of the house without the dog freaking out. But it's not the best way to go around things, and you get a lot of good information out of Ness Jones' talk. She's got a high level of expertise in helping with separation anxiety, and you definitely don't want to do what you're doing. You want to change that, but how you change that, listen to Ness Jones talk. Set up a video camera so you can watch your dog when you go out with separation anxiety. If you are going to be doing desensitization to you going, then you want to be able to see the dog so that you make sure that they don't escalate into higher levels of fear, arousal, and stress when you leave. How best to stop my scratchy Staffy when he does start scratching? I hold his paws and gently tell him to stop. He's dog reactive. I use space and food to desensitize him. It's slowly working. So the best way to stop your itchy dog scratching is to get to the root cause of the problem. That is the allergy that's causing the itchiness. And you'll need to work preferably with a holistic veterinarian to do that. Now, first thing that I say to every itchy dog, if the dog is itchy and on kibble, then I say you need to get onto a fresh whole foods diet and off the kibble. Really, really, really important, and often getting off carbohydrates and onto a fresh, preferably raw, whole foods, BARF type, BARF, biologically appropriate raw food type diet can often make a really, really significant improvement in the itching. If it's a seasonal allergy, like a pollen-based allergy, then local raw honey can be a really good natural desensitization allergy treatment. And CBD can help with itches as well. There's a range of more holistic alternative complementary herbal medicines and other medicines that can help with itching. But he's scratching because he's itchy. So if you really want him to stop scratching, the best way to stop that is to do what you can to stop the itch making the scratching happen. Okay, we've got about 5 minutes left, so I'm going to be able to cover a couple more questions. But just before I go to the last few questions, I want to invite you to consider upgrading to the VIP pass if you haven't already, so that you get lifetime access. You're probably realizing by now that, wow, there is a lot of information in this summit. These speakers have transmitted an incredible amount of information in their presentations and interviews. And you may want to go back and review what you've learned. If you get the VIP pass, the all access pass, then you'll have lifetime access to this incredible library of information. In addition to that, we have the the post-summit anxiety masterclass. I would love to have you come along. Please pop the links in the chat again for both of those, Jindy, as we go, because I think then it's often easy for people to click in the comments to get them. Which is going to be 4 weeks where I'm going to take 20 of you beautiful people with your anxious dogs through the process of creating and implementing a holistic anxiety treatment plan for your anxious dogs. So you'll see there's the one with Masterclass at the end, and the links in the comments is what I'm talking about there. We only have space for 20 people. If you click on that link, you'll go through an application process where you'll have to answer some questions as to help us make sure that we can see that it's going to be a good fit for you and helpful for you. And then at the bottom of the comments right now, you'll see the link with order on the last bit of it. That's where you can come and get your all access pass so that you get lifetime access to all of this information. And right now, I'm going to take maybe 1 or 2 more questions. Then Pearl and I are going to get moving and have some breakfast and get into the day here in Australia. From Ruth, I have an 11-year-old dog with epilepsy. She's on phenobarbital. The dosage was increased recently because of breakthrough seizures. Is it okay for her to take gabapentin during fireworks time? Just going to have a little double check online to see if there's any interactions. So you might get increased side effects from the gabapentin, such increased side effects such as dizziness, drowsiness, confusion, difficulty concentrating. So heavier sedation. Phenobarbital at higher doses can be a sedative and anesthetic. So you would need to be careful about possibly a reduced dose rate of gabapentin. You'd need, your vet should be across that and know how to be that. And as Dr. Christina is saying in the chat too, that homeopathy and traditional Chinese veterinary medicine have helped dogs get off seizure medication, so it might be worth exploring that. Also, I've found CBD to be a fantastic medicine for epilepsy. It also helps with anxiety and should be totally fine with the with being on phenobarbital and CBD. Though again, if you go on to CBD, you might be able to reduce the phenobarbital dose too. So I brought my now 3-year-old Chihuahua into my home when he was just 2 months old. He has never been able to settle down. He hears and reacts to every close or distant noise and movement. CBD doesn't help. Any ideas how I could help him? So number one, and Jindy, after this question, I'll take Gang's question on the Westie with the pig's tail as the last question for the day. But this little one that hears and reacts to every close or distant noise or movement, with the movement, block the line of sight to movements. Make a visual block so he can't see the movements. That will reduce that stimulus going in. With the sound, I would really think that learning how to do the therapeutic touch, the relaxing touch, would be very helpful for you to help this little one. Ambassador Tiffany says, how can we know which CBD is the good one? Go to earthbuddy.com. They were our sponsors on this summit. They have fantastic, high quality, organic, whole plant extracts. And we're going to take one more question. So my Westie's on a raw food diet, but the recommended pig's tail for bone nutrition, she does extreme guarding behavior. Is it necessary to continue to feed bones for health? It is helpful to feed bones, especially for dental health. And this behavior, if it's a problem, So there's a couple of things you can do. One thing that I'll do with a dog like that is I'll give them their bone with maybe a meter or two of lead clipped to their collar, so that I've got a handle that I can pick up and I can move them away from the bone without having to go into their guard zone and trigger that behavior. I would also very strongly recommend that you work with a good positive reinforcement trainer to reduce this behavior. But the reason that they're guarding the bone is that that's very high value for them, and they think they don't want anyone else to get their bone. They're worried you're going to take their bone. Another thing is that you just you can train it out of it, or you can not give them bones at all. You might want to play around with some different kinds of bones. Perhaps their bone will be lower value, but if you can desensitize dogs to this behavior and reset that behavior, there is really high value for your dog's dental health in being able to have bones. Another thing might be that you give your Westie something like a chicken frame, a raw organic chicken frame that they can eat quicker, and that you just leave them alone while they have it. If you don't have kids and stuff, that could be an option. But absolutely, you want to make sure that you change that behavior, especially if you've got kids in the house. You'd either need to avoid bones or retrain so that that's not a problem. So Regan's saying, will the silent pain webinar be available as a recording? Yes, if you register, you'll get replay links to the things. Now, we're going to wrap it up for today. It's been another awesome session. We've had a lot of you on, 60 plus people, most of the Q&A, which is totally awesome. If you look at the comment stream at the bottom right now, the comments, you're going to see a series of links. You've got a link to apply to join us in the post-summit masterclass, the anxiety masterclass, where you'll be learning how to create and implement a holistic anxiety treatment plan for your anxious dogs with me. Only 20 people allowed. If you're keen, jump in and apply, because you might miss out if you don't move fast on that one. If you want lifetime access to all of the videos on all of the days, then you'll see another link there with Premium Pass to invest in that. And you'll also see the Silent Pain Masterclass from me, which you can register for. Okay, that's it for the day. We've got one more day in the summit to go, which is veterinary treatment of anxiety. Very important day tomorrow. You're going to get some great presentations. I'll just quickly remind you of what you're going to see tomorrow. You're going to have Dr. Alex Avery, who's going to be talking about why you need to have a veterinary examination, because it's so important to pick up undiagnosed pain or other disease that can be causing or contributing to anxiety in your animals. Dr. Christopher Packle, who is our board-certified veterinary behaviour specialist, amazing, holistically minded specialist. He's going to be talking about veterinary prescription medications, when and why they might be needed to get the best outcomes possible for your dogs. Dr. Matthew Muir is going to be talking about integrative medicine, herbal medicine, and diet for anxiety. And again, we dig into the gut-brain axis in that talk. Dr. Charisse Roth is talking about vet-pet wellness. The other end of the treatment leash, the professionals who care for your animals. I'll be talking about healing anxiety with intentional touch. We'll have Dr. Fossum talking about CBD as a treatment for anxiety. So I will be excited to hang out with you all. Link for the CBD, Dr. B recommended. So it's earthbuddy.com. Earthbuddy.com is the site where you can get the really good CBD from our sponsors. And if you've got any questions about CBD, you can contact through earthbuddy.com, and Sean and the team will be very happy to answer your questions. But right now, Pearl and I are going to say goodbye for now. We'll see you back tomorrow, same place, but an hour later time. So I look forward to seeing you on the live Q&A tomorrow. Have a beautiful day with your pets, and bye for now.